Welcome, my name is Veronica Schiariti, and on behalf of the Latin America Academy of Child Development and Disabilities, I'd like to describe this invited editorial on the human rights of children with disabilities during health emergencies, the challenge of COVID-19. You can access the content of this editorial in Spanish, Portuguese, and traditional Chinese in the Developmental Medicine and Child Neurology website. What motivates this editorial? Outbreaks and health emergencies such as the ongoing COVID-19 pandemic pose many ethical and public health questions on how to adequately respond and control transmission. The overall purpose is to keep populations informed and safe. In order to do so, public health strategies sometimes require restricting any while individuals' rights to freedom of movement and association, for example, quarantine in the interest of the greater population. But during pandemics, it is crucial to monitor the implementation of public health strategies with conscious attention to human rights, especially of those individuals living with a disability. Nowadays, outbreaks disseminate faster and further with greater impact globally. Moreover, the WHO's report on disability showed that over 1 billion of the world's population, almost 15%, live with some form of disability, of whom 2 to 4% experience significant difficulties in functioning. This shows the importance of establishing links between disability and health emergencies and the need for action on inclusion. In time of crisis, including warfare and natural disasters, children with disabilities face additional challenges as a result of their functional limitations, but most importantly, the many barriers that society throws in their way. Lack of inclusive humanitarian response, neglect, and separation from family members are common ways of violations of rights of these children. In light of the ongoing COVID-19 pandemic, it is important to raise awareness of the individual and collective human rights to equally access services and ensure that all people are treated with dignity and respect. Prevention is the most powerful health promotion strategy. Having rights-based strategies and tools in place before the events happen is key for an inclusive response. I want to highlight that there are available tools, open access, that you can access online, promoting an inclusive response, and I provide the references in the editorial, but you can see there are some tools from WHO, and this tool that I'm highlighting, created by Handicap International and published in 2012. These tools describe toolboxes and toolkits with case scenarios that will show you how to create a comprehensive and inclusive response. An inclusive approach to health emergencies ensures that services and systems are adapted to meet the diverse needs of community members and that all individuals are empowered to take action to reduce their own risk. Adopts a rights-based approach, puts a great emphasis on the decision-making role and autonomy that persons with disabilities should have over their lives, and ensures that persons with disabilities have roles and responsibilities in the design and implementation of the public health strategies. I want to share some facts about COVID-19. The COVID-19 pandemic continues to develop with rapid spread across the globe. Overall, there are 180,000 total confirmed cases around the world, and this is as today, March 17th, 2020, on the daily WHO report. The majority of cases are mild, but 1 in 6 cases develop a severe clinical presentation. Public health agencies are under pressure around the world to interrupt human-to-human transmission and save lives. And due to this global health emergency, several public health measures are in place. For example, we are going towards a global quarantine. And it's important, it's crucial to plan and implement strategies with persons living with a disability and their families. Again, this is from the WHO report, and it shows the distribution of confirmed cases around the world. And you can see the majority of cases right now are in China, South Korea, Iran, and northern Italy. But as you can see, it's spreading fast and it's impacted many countries. On behalf of ALDID, I would like to advocate for clear standards on inclusive humanitarian responses in our communities, ensuring that we all benefit from an inclusive rights-based approach during health emergencies like the current COVID-19 pandemic will have a positive impact on the well-being of persons with disabilities, their families, and our communities. I want to invite you to check the references on this editorial and also the additional resources that I'm showing in this slide, the Open WHO, an interactive web-based knowledge transfer platform offering free online courses to improve the response to health emergencies, and the WHO coronavirus disease advice for the public, which has many videos accessible to the general public. Finally, let's keep our colleagues and communities well informed. Slowing down the spread of COVID-19 is everyone's responsibility now. Thank you for your attention.